The healthcare detective, Frank Lalli, has written a book for Simon & Schuster about how to get affordable healthcare called Your Best Healthcare Now. It is available online, in-store, wherever fine books are sold. Mr. Lalli is also the health correspondent for Parade and the former editor of Money and George magazines. He joins us when he can. He knows of what he speaks. Today, more Medicare. Hi, Frank. How are you?
I'm fine, but you're exactly right. We're in the middle of this Medicare open enrollment period. It's time to start shopping carefully. Eligible for Medicare, circle December 7th. That's the stone-cold deadline to choose your 2019 Medicare coverage, and they're serious about it, folks. Not a tick past midnight, December 7th. You face two basic choices. Should you pick original Medicare, that's run directly by the government? Two-thirds of beneficiaries do that. Or should you take Medicare Advantage plan that's sold by private insurers, and these are the big guys, like United Healthcare, Aetna, our friends at Blue Cross. About a third of beneficiaries do that, but that's an increasing one-third. It goes up a tick or two every year. So I understand this completely. The hype surrounding Medicare, I mean, not only the hype, but the insurance jargon, the arcane rules, that can make Medicare shopping seem hopelessly confusing. That's why, frankly, 80% of Medicare customers don't even try, even though studies show half of them would find a better plan or save money or both in about 2 hours, and in some cases less than 2 hours of effort. You can save a lot of money for an entire year. So if you're feeling overwhelmed by Medicare choices, take a deep breath. Get away from the television with all those blaring commercials. Take a deep breath. I'm here to tell you that your best decision is as simple as this. If you're worried about your health, enroll in Original Medicare. If you're confident about your health, look into Advantage plans. That's the succinct advice I got from Greg Geddes. He's a veteran Medicare insurance agent. I've known him for years. I've respected him for years. Just talking to him this week, he saved me about $1,000 on my 2019 coverage. So grab a pencil, because in just a bit, I'm going to tell you how to reach Greg and a few others you can trust to help you. But for now, Jill, I'm going to ask you a question. If you had health issues, what insurance features would you want?
The main thing would be that whatever my health issue was, I could deal with it and its ancillary elements without thinking about it. In other words, if I had high blood pressure and I needed XYZ, I would want to be able to get what I needed when I needed it, without having to pounce around trying to find someone else who could deal with it that covered or didn't. So basically, it would just be, what I would need to treat that issue, plus the basics. Mm-hmm. So that's...
Yeah. So, all right, I'll give you a 90 for that answer, because what we're really boiling down to is access to the broadest number of doctors and hospitals that you can have. Now, I'm enrolled in Original Medicare. I think listeners know that, for 10 years now, I've had this blood cancer. It's treatable but not curable. So I want universal access, as close to that as I can get. So with Original Medicare, you're going to get about 90% of all doctors that are enrolled in Medicare, roughly 75% of all specialists, and virtually every hospital in the country. We've got about 5,000. They're all signed up for Medicare. So you hear a lot. People say, gee, that can't be true, because I hear a lot about doctors dropping out of Medicare because the government doesn't pay them enough to cover their, 4 cars and their second homes or whatever the deal is. Look, I say, big deal. I've dealt with this problem before, and I've dealt with the problem this week, and it lasted for 1 day. My doctor referred me to a specialist right here, and our cheery assistant was, setting up the appointment. She was all very nice and so on. And then almost like a throwaway line, she says, oh, by the way, we don't accept Medicare or any other insurance. Is that okay? And I said, oops. No, that's not okay. And that was the end of that conversation. I called my doctor back and said, find me another specialist just as good that takes Medicare. And guess what? My doctor found another doctor that very next day. So the stuff you hear about nobody takes Medicare anymore, don't believe it. It's true. Also, I can go anywhere in the country without worry. Medicare benefits are covered coast to coast 365 days a year. So access like that is in sharp contrast to Medicare Advantage plans. That's the thing you've got to remember. Medicare Advantage plans cut their costs by limiting you to tight networks of doctors, hospitals, specialists, often just the tight network in your own county. So if you go out of your county, let alone out of your state, you could get hit with out-of-network charges, and good luck. They are way more money. Surprise bills, that's how you get hit with a lot of surprise bills going out of network, which is easy to do in an Advantage plan. In addition to access, I want protection paying my bills. So I'm also enrolled in a Medicare supplement plan, Medigap plans, as another word for it. You see them on TV all the time. And indeed, they pay 20% of the doctor bills that original Medicare doesn't. So they're not cheap, especially in my case. They're not cheap. My supplement plan cost me $260 a month. That's a hefty check to write every month. But in my case, it saves me tens of thousands of dollars in a year. Now, you probably won't use it as much as I do, or healthcare. But even then, it can save you hundreds of dollars a year. So I think that's if you're going to get original Medicare, get a Medigap plan to back you up so you don't get hit with big bills. So, okay, Joe, we're going to turn to you again. If you're not worried about your health, what insurance features would you want?
Least costly, reasonable, but I would like to be able to see a doctor. If God forbid anything happens, I still need to be able to not be standing there going, "Oh, gee, really wish." So, combination of
you got half of you'll get half with an Advantage plan. I mean, you talked about cost first and then access.
I understand, but cost.
Cost is a biggie.
Okay, but wait 1 second, because bluntly, the whole purpose of having insurance is to use it when things go bad, and life is a constantly evolving thing. So you can't.
Well, that's why I lean toward original Medicare. But if you're really feeling confident about your health, and a lot of people are, Medicare Advantage offers 4 big attractions. First of all, they have to cover all the benefits, not the networks, okay, but the benefits of original Medicare. So you're getting the same level of care with their doctors. That's number one. But then their Advantage plans are cheap, they're convenient, and they're full of some really helpful extra benefits, advantages, if you will, Advantage plans, right? So how can these Advantage giants, how can they afford to throw all that in and still make a buck? Well, here's the secret. The government, that's me and you as taxpayers, pay these Advantage giants huge subsidies of up to $700 a member per month. So with all that taxpayer money rolling in, the Advantage plans can slash their premiums and literally down to zero. Around 40% of Advantage members pay no premiums. Now, I don't think all of them realize that without paying any premiums, the insurance company has to collect money, so their co-pays and their deductibles on those plans are high. But they can walk around saying, I pay no premiums, and indeed they don't. Second, Advantage plans offer medical, prescription drug, vision, even dental coverage all in one. So it's very convenient to shop and get it all in one phone call. With original Medicare, you have to shop for each of those coverages separately. I have 4 Medicare plans, and it is tedious each year to sort it out and get the best of all 4 of those. Third, Advantage plans throw in extras that are very attractive. I mean, phone numbers where you can call a nurse 24/7. Just if you have a concern, not an emergency, but need some guidance or just some reassurance. There's a phone number, a nurse on the other end of the line, 2 o'clock in the morning. That's a good perk. gym memberships at no extra cost, and new this year, lifestyle perks. And we've talked about this: delivered meals, transportation to doctor appointments. You're having trouble getting around. That's a wonderful extra. And in your home, wheelchair ramps, grab bars to keep you from falling. We know how serious it is when people fall and can break their bones or bang their heads and get concussions. Just happened to a relative of mine. It's terrible. And also, the Advantage plans can now pay for home caregivers to help members get dressed, eat better, shower, and bathe. These are all very positive things. I wish they were available in original Medicare, too. I wish the government would invest in that. But right now, they are available through Advantage plans, and that's a big plus. So, okay, I ask you to grab a pencil. Grab that pencil now, because I'm going to give you a couple of numbers where you can call to get some help from people you can trust. If you're leaning toward original Medicare, call VIA Benefits. That's VIA, VIA Benefits at 855-801-9762. And that's anytime Monday to Friday, 8 a.m. to 9 p.m. There are licensed agents there. They're very knowledgeable. They'll steer you to solid options, and that's no extra cost to you. It's all paid by the insurance provider. If you want to look into Medicare Advantage plans, go to Medicareful.com. That's Medicare and then F-U-L, Medicareful.com. There, you just enter in your zip code, and up pops the 20 or 30 Advantage plans in your area. And it's very easy to just compare the costs and the features side by side on any of those Advantage plans that look attractive to you. Or, here's another option. Call my friend Greg Geddes. He's at 855-94, I'm sorry, let's do it again, 855-494-0097, 855-494-0097. If he isn't licensed to sell you a policy in your state, he'll put you in touch with a colleague who can help you. So just one more thing while we're talking about these Advantage plans. Another thing that always bothers me about them, they're notoriously stingy, especially when it comes to emergency room bills. And the emergency room bills can climb out of sight in a blink. There's a case in my book, Your Best Healthcare Now. There was a woman on vacation in Florida. She had a tumor in her brain. She wasn't aware of it, obviously. It got to the point where it overwhelmed her. She fell and broke her hip. She was rushed to the emergency room, where it took $100,000 worth of care to get her stabilized. Now get this. Her Advantage plan said that was not an emergency. Not an emergency, not even urgent care, and they didn't want to pay the bill. So obviously that one ended up in court, and the Advantage plan lost. But it's a terrible thing, and then they had to pay the bills. But it's a terrible thing to think that you'd have a trauma like that, and then have to, when you're feeling a little bit better, then have to fight with the Advantage plan about whether they're going to cover $100,000 worth of bills caused by your brain tumor. Anyway, I hear too many of those stories, and it makes me leery of Advantage plans. But that's my personal bias, and as I say, I'm the ideal candidate for original Medicare because I have health concerns.
Thank you, Frank, the healthcare detective and the health correspondent for Parade. Send your questions or concerns about finding affordable health care to healthcaredetective@robinhoodradio.com. Frank will try to address as many of your questions as he can on future broadcasts. And look for his book, Your Best Healthcare Now, available in-store, available online.